Cataract is a common disorder of the elderly and is seen in more than 60% of the population above the age of 50 years. Hence it is prudent to have guidelines for uniform, standardized and evidence-based care. For this purpose, patients are divided into two groups, those with visual acuity of 6 by 60 or less and those who have visual acuity of 6 by 36 or better. This helps in having uniformity amongst the staff in communicating with patients. We request you to subscribe our channel if you like our content. The description of this video has buying links for the surgical instruments used in cataract surgery. Patients with uncorrected Snellen visual acuity 6 by 24 or less are unable to carry out routine work or the desired activities. It is good to know his or her perception of disability's impact on the lifestyle. Urgency of the cataract depends on the visual acuity in the other eye. Poor vision in the other eye adds to a patient's disability. Cataract surgery should be done within a month in cases of bilateral cataract and fellow eye having vision better than 6 by 60. Cataract surgery should be considered within a week in cases of bilateral cataract and fellow eye vision is worse than 6 by 60. But one should consider cataract surgery immediately if the affected eye has the vision of finger count close to face and cataract is advanced. It is recognized that some patients with visual acuity of 6 by 18 or better may still have significant functional visual disabilities that may benefit from cataract surgery. However, with this level of visual acuity the risks of surgery relative to the potential for improvement of vision are higher. In this instance the cataract surgery is justified and appropriate, when some of the subjective and objective criteria are met. Patient can be considered for cataract surgery when the ability to carry out essential or desired activity is impaired, based on the patient's own assessment of his visual disability. He may also be considered a fit case for surgery if she or she complains of disabling glare. The objective criteria for considering cataract surgery in a patient have vision better than 6 by 24 are following. Central, posterior subcapsular cataract. Cortical cataract extending into the pupillary area. Nuclear sclerosis, associated with high lenticular myopia of more than 3 diopters. Whenever there is a need for detailed evaluation of the posterior segment by fundus fluorescein angiography or laser photocoagulation is indicated. However, it is preferable to have a thorough evaluation of the posterior pole to ensure that cataract is the cause for defective vision, and if necessary one should obtain a second opinion in these cases. There are situations when patients will not be benefited by the surgery. Cataract surgery should be avoided in such patients. These situations are: surgery will not improve the vision by at least 2 lines nor is required for posterior segment evaluation or treatment. The patient is medically unfit. The patient does not desire cataract surgery. I hope you liked the video. Feel free to share your views on this issue in the comment section. Check the description for similar videos and product links.